Environ Life Science Limited, partnering for life.
Namaste, this is Dr. Hrutuja, that is telogenic, what is telogen effluent, and what happens during pregnancy, or why do we face extreme amount of hair loss during that time. When we talk about telogen effluent, so it is a temporary hair loss condition that results in excessive shedding of hair. So what does that mean? So it occurs when larger than normal percentage of hair follicles, they enter into telogen or resting phase simultaneously. Now this causes hair to fall more rapidly than usual. So this condition can be quite distressing for us as women, but the good news is it is just a temporary condition and it all goes back to normal, and once the underlying cause is addressed. So let us understand why our hair go into the telogenic stage or telogen effluent that occurs during pregnancy. So during pregnancy, a woman's body goes through numerous amount of hormonal changes to support the growth and development of the baby. So in these cases, these hormonal shifts that can also affect the hair growth cycle. Now, normally hair follicles go through something called as phases, such as growth phase, also known as anagen phase, a transitional phase, also known as catagen phase, a resting phase, which is also known as the telogenic phase. Now, what happens is around 85 to 90% of our hair, they're normally into the growth phase or the anagenic phase. But during pregnancy, due to more number of hormonal changes, due to multiple changes happening inside our body, major amount of hair follicles, they shift into telogenic phase. Now let us understand what factors contribute to the telogenic effluent phase. Now one is the hormonal changes. Now elevated levels of estrogen during pregnancy also lead to this hair growth phase, or it can prolong the hair growth phase. Now what happens is after childbirth, when hormone level drops, a large number of hair enter into telogenic phase, leading to shedding. Now, another cause is nutritional demands. Well, as we know, during pregnancy, we're not just feeding us, but also another being that is inside of us. So in these cases, the nutritional demands tend to change or rather increase. So in such ways, our body usually redirects these nutrients away from hair, which leads to changes or it affects our growth cycle. Now, another cause is stress. Pregnancy can bring a lot of stress based on our emotional needs as well as physical stress, which leads to contribution towards hair shedding. So now these stressful hormones known as cortisol, they might disrupt the hair cycle. Now let us understand how we can manage this telogenic effluent during pregnancy. Well, we need to understand this factor that this is always a temporary thing and it is not going to last forever. So in these cases, also we cannot go for any significant amount of changes, such as we cannot go for any treatments as such. So what we can do is we can go for a balanced diet where we can complete all our nutritional requirements, such as if we are consuming enough amount of vitamins, minerals, proteins, and all our requirements. And also what we can do is we can do gentle hair care. So that includes mild shampoos and avoiding harsh chemicals and excessive hairstyling that can further lead to stress on our hair. Now, how to manage stress? So, we need to take care of ourselves during this time because it is one of the most important times of our lives as women. So what we need to do is a bit of exercise, meditation, yoga, deep breathing. So these things can manage our usual stress levels. Now, another thing what we can do is if all these things are not helping you out, maybe there could be any underlying cause or some underlying reason that might lead to excessive hair loss, after postpartum. So what we can do is you can, meet your healthcare professional or doctors like us, and we can rule out any underlying medical condition that is causing this excessive issue, and then you can get a proper guidance. Now, the last thing that you can do is postpartum recovery. So often hair loss increases after birth, and hormone levels, they tend to stabilize after that. So however, this hair loss tends to reduce postpartum, and it tends to just go out of your life or just go off from the cycle. But even after postpartum, this does not stop, or this continues excessively. You can visit us or any healthcare professional anytime. You can consult and you can get the required treatment as and when required. So now, coming to the conclusion, let us always remember that experiencing telogen effluent during pregnancy is relatively common, and in most cases it is always temporary. So it's essential to focus on overall health and well-being during this time. If you are concerned about your hair loss, it's better you consult one of your healthcare professionals that can provide you with personalized advice and reassurance. So embrace the beauty of pregnancy, the journey of motherhood. Hair loss through these challenges, it is just a small part of your incredible experience. So do not forget to subscribe, this channel, as you're getting such informative information, and let us all come together, gather such information, and understand all these things at the slightest and in the most simplest manner. So thank you for listening to us, and I hope this was very informative for you.